just to kind of get started off, we'd like to open up if anyone has any particular questions that they want to make sure we kind of tackle today at the end of the lecture. Feel free to speak up and share if there's anything, any burning questions you guys want to ask, health related, not necessarily specific to tonight's topic.
We have a product that we'd like to look at. Would that be at the end?
Sure. Yeah.
Yeah, at the very, very end, like just come. We'll stick around for questions individually too. Any health-related question? Yeah.
I have one. For sugar substitutes, I was wondering how you felt about honey, like using it in baking, and then kind of part B to that is erythritol. I'm wondering what that is.
Okay.
You're both practicing here in towns. As a patient, I am admitted to, let's say, Kootenai. Are you allowed to come in and assist us, or do they accept your accreditations?
In a hospital setting or working adjunctively?
In a hospital setting.
In a hospital setting.
Will they allow you to come in and help with the diagnosis, and if I am your patient?
As of July of 2020, yes.
I kind of wondered about that. Things are going on, so.
Wow.
And that's through the Mayo Clinic?
Just through the state of Idaho.
So through the state of Idaho then, okay.
Yeah, Jane.
Does that mean that you'll start accepting insurance?
Insurance paradigms are completely separate from licensure laws. So, yeah. Yeah, so, you know, right now, in the times that I've interfaced with patients at Kootenai, it's, you know, certainly a lot of collaborative care with physicians there, and, you know, communication back and forth, but I don't have hospital admitting privileges, if that's what you're asking.
Well, a part of your diagnostics and the way you do, when we've tried to do the homeopathic and natural ways too, is not always accepted by their ways. So
yeah,
they do this and keep you out of there as much as they can.
Yeah, that comes down to a more individualized question too, for sure. Other open health-related questions, any and all? Let's chat.
Will you be discussing amalgams and root canals?
Yeah.
Is that forever?
Oh, yeah. Others? Yeah, no, just keep going. If you have
Okay, all right. Exercising when it comes to like, you know, doing Ironmans, decathlons, marathons, things like that, just your feeling on what could be too much exercising, if that's possible.
Anybody else?
I guess I do have one. Turmeric taken with pepper on a daily basis. Is it, you know, should be taken with water, should be taken with food, should be taken with fat? I don't know.
Are you just asking the best way to absorb it, or? Okay, sure.
I have a question about that also. Is it around the black pepper? So black pepper's in a void, you know, all of that.
Sure.
And then the boswellia, which I don't really know anything about, but we talked about it for a few seconds at some point, related to the turmeric and how that is, what form and how is the best way to utilize it.
Sure. Yeah. Any others?
Well, mine's about my baby's stool. It sounds gross though, so should I just ask that afterwards?
I think it's a super individual question, probably.
Okay.
Sure. Yeah, anything else? Okay, short list tonight. Great. So Dr. B and I are going to hang out and answer these lecture. So thanks, Dr. Munoz. She's going to pop back up in a little bit. A few things about open forum. So first Wednesday of every month we do this class. It is something, I'm going to pass this around if you want to get our emails from the clinic. It's something that my predecessor, Dr. Todd, started over 30 years ago and took a 20-year hiatus, and then we kicked this off 7 years ago again, and so it's a really fun thing to do with the community. Patients, non-patients alike, it's a time to come in and dialogue about health, and it is a conversation, so interrupt me, raise your hand, ask questions. I want this to flow, and you guys to learn what you want to get out of this in our time together. So it's being recorded. We have a little camera over here, and these recordings go up onto our website, quarterlyhealingarts.com. And so it'll be up in probably a week, and if you want to rewatch or show it to someone or you miss things, know it'll be there. And there's a bunch of other great stuff about our clinic and what we do as naturopathic physicians up on the website if you don't know much about us. I like to kind of start off, usually before I get going, getting any hands of people who've never been to open forum. There's some new people.
Never been.
Okay, cool, welcome. Yeah, so nice to see some new faces. So what we're going to do now is kind of pivot into the topic I kind of came prepared to discuss, which is dental health. Looking a little bit more about dental procedures and relating dental health to systemic health. It's a really, really important topic, and sadly I think there's a bit of a disconnect between the dental world and the medical world that really is worth bridging, and it needs to be bridged because the two influence each other profoundly. The health of the entire body being tied to the health of the mouth, and vice versa, the health of the mouth being tied to that of the entire body. And so we're going to kind of look at those intersections tonight. And so I think a good starting point in this conversation would kind of be to, talk about dental health and how we traditionally understand it and what some of the principles are of that. And, I like to zoom out as far as I can and then zoom in. So, I want to talk a little bit about just how the mouth works in health and disease. So we have different types of tissues in the mouth. We consider the mouth a mucous membrane. So there's several mucous membranes: the sinuses, the ears, the intestinal lining, the vaginal lining, the urinary lining. These are called mucous membranes. So they're a little more vulnerable than the skin. They have less immunoprotection. They are permeable, meaning things can absorb in and out of them, but it's not like a totally wide open pass-through. There's a lot of protection still, so there's still a lot of defensive tools to kind of guard against things moving right into the bloodstream. And so we don't tend to think of the mouth as an absorptive surface, but certainly things absorb better in the mouth than they do, say, on the skin. All of the mucous membranes also have a trait in which they harbor colonies of microbes. Done past open forums talking about how we're 90% bugs, right? Like there's 90% of the cells that exist within us are microbes that are actually foreign to us. So we call it the microbiome. They mostly are in our gut, but the mouth is certainly a very important place where we harbor microbes and where they live and thrive. So that becomes really important in understanding dental health, because that microbial community really influences a lot of the things that can go wrong with the mouth. So like when you're looking in the mouth, you got the tongue, and this is where we kind of shovel food around as we chop it down and break it down into smaller parts. And it's also where we get taste from, or at least a third of our taste. The other 2/3 are from our olfactory, our smell. Then we have, of course, the teeth, which is actually what breaks down our food. So we bite with it, we chew with it. The front teeth are more incisors. They're more to like break big pieces of food into a little bit smaller, and then the molars in the back are to kind of crush food into ideally the smallest surface area possible before we swallow it, so it's easier for the rest of our digestive system to assimilate. And there's, in a healthy mouth, 32 of them in an adult mouth, and evolutionarily we start as children with our first set of teeth. We actually molt a set of teeth as we grow older. All of us know this to some degree, or can remember it. So, but in the adult mouth, there's 32 teeth, 4 of them being wisdom teeth in the back 4, which are often, removed because most people evolutionarily now don't really have space in their mouth for them. So that's a procedure that an oral surgeon does to pull those teeth out. And so those teeth are held in place. They're live tissue, first of all, so even though they're very hard, they're held in place by ligaments called periodontal ligaments. So there's like these kind of connective tissues that anchor. Ligaments are things that anchor structures to bone, so they anchor the teeth to the jaw. And so we'll be talking about the periodontal ligament in a little bit here, and it's important to this topic. And then as they're anchored in place into the jaw, they're covered with a soft tissue we call our gums. So this is a tissue, part of the mucous membrane, that go over our teeth and kind of move into our palate on the top and bottom of our mouth and kind of around our lips. So it's a soft tissue. It's also an area that we tend to have a lot of issues arise in the mouth. Periodontal disease is what we'll refer to around that. It has to do with inflammation and destruction and degradation of the gums. So the teeth, obviously, like if anyone's ever had dental work done, it can be painful. So the teeth are innervated. The cranial nerves, specifically cranial nerve 5, is the major nerve responsible for innervating the mouth. And so oftentimes you have to have a dental procedure. They'll inject lidocaine into the gums that will block those nerves. So we do have a sense of feel in the teeth, and it extends all the way through to most of the layers of the tooth itself, except the very outer layer, also known as the enamel. And if you look at a tooth itself, and I'm actually going to draw just a little picture because we're going to kind of get into some procedures. So if this is a molar, you have on the outside enamel. It's like this thin layer. It's a really hard surface. It's made of a lot of minerals. And then you have within that, let's see, I'm not drawing that great. There's these little roots and little roots. So this area in here is called dentin, and that is innervated and has blood supply. And the main flow of the nerve and blood supply come through the roots, also called the pulp of the tooth. And then down at the bottom, these are kind of these nerves, and the roots of the tooth are tied in by these periodontal ligaments. And basically you have kind of the gums, the soft tissue that comes up the side, and then there's a tooth next to it, of course. And then you have down here the actual tooth kind of nestled in bone. This is the jaw. So that's a little kind of picture, just to give some awful visual, but this anatomy is going to be important as we talk about what happens in the mouth. So, you know, let's get back kind of to the bigger picture of like, you know, our dental health. And we have to, I think, when we talk about our dental health, certainly we can mention genetics, and some people have an oral cavity, teeth that tend to break down and degrade more readily. I mean, I just liken it to any other health condition or process that we all are born with vulnerabilities. And for some people, teeth can be a major vulnerability, and they can really have a lot of dental issues. And families, you can see this through the entire family. So there are some genetics about the strength of the enamel, about how easily, you know, pathogens can invade that. But I think for the most part, you know, dental health really has to do with environment, like all of our health does in every other global aspect. And when it comes down to that, it's really important to understand the microbiome, the microbes that live in the mouth, as really fundamental to shaping the health of the teeth and the gums and the bones in the mouth. And so when we look at that, there's actually quite a bit we've learned in recent years about, you know, who gets gum disease, who gets cavities or decay in their teeth, and what kind of microbes are hanging out in the mouth. And we've identified and researched, you know, dozens of strains of bacteria that are more likely to, you know, be associated with these types of problems. The one that's most anciently known that is really common, I was taught in school, one called Strep Mutans. This is a really common microbe associated with that. So definitely the conversation, kind of like in naturopathic conversations at the clinic when we're talking about people's gut health, in the mouth, same thing. It has to do with the microbes that live there and what the balance of them is. And just like we notice that some microbes are associated with decay and inflammation of the gums, we notice that other microbes are associated with much higher levels of dental health and much less decay and less inflammation. So that's really key, this idea that that microbial community, its equilibrium and how we can influence that. And so what happens is because there's bugs that live in our mouth, as we go through our day and we eat food, the food we're eating, those bugs are sampling the food. And each time we eat, they're growing a little more. And so they just kind of keep on growing at different rates, kind of depending on what we eat, unless we do something to kind of brush them off the surfaces. And this is unique to the mouth because all the other surfaces in the intestine, you can't really brush microbes off, right? They're there. And there's nothing that really can physically move those microbes and disrupt them. Well, of course, we're all familiar with dental hygiene practices. And so this is where toothbrushing and flossing and things like tongue scraping and oil pulling become a really big deal, because these are ways to disrupt the bacteria. Primarily it's bacteria that's going on in our mouth. Sometimes it's yeast, sometimes it's parasites, but mostly it's bacteria. So we can disrupt that, and it's actually really important to reduce the likelihood that these colonies build to the point of causing decay in the tissues in the mouth, that we disrupt them at least every 24 hours. And of the two things, flossing and brushing, you know, even more important than brushing is flossing, because the places where those microbes can really flourish and start to cause issue in the gums and the teeth is in between the teeth and in the gum line, which is really the main place where we're accessing when we're flossing. Yeah.
So what does something like Listerine mouthwash do to this?
Yeah, so there is an antimicrobial benefit to Listerine, but the problem is it's non-distinctive, right? So when you're looking at the bugs in your mouth being more in an ecosystem and having a form of homeostasis, when you bring something in like Listerine, you're wiping everything out, And it's like a race to which types of microbes are going to grow back the fastest. Sometimes those aren't the ones you want. Plus, you're not actually wiping everything out because that Listerine doesn't get between the teeth, right? Those little interproximal spaces where the floss is getting under the gums, Listerine's not washing into there, and that's where a lot of the dental issues start. That's where a lot of the inflammation starts. That's where a lot of the cavities begin. You're not getting that benefit from Listerine. Yeah.
So would you recommend not using it then?
I don't tend to recommend mouthwash. If you're going to do something more oral to the whole cavity that really is beneficial to the biome in there, I'm a much bigger fan of oil pulling. And oil pulling has a really beautiful effect of, reducing a lot of the pathological microorganisms while keeping, the balance in place.
What's oil pulling?
Oil pulling is taking a tablespoon or two of, I like to recommend coconut oil, which is solid at room temperature, but you can just put it on a spoon, and once you start swishing it in your mouth, it'll turn to liquid really quick. And swishing that oil in your mouth between 3 and 7 minutes, once a day. Yeah, so it's in Ayurvedic traditions, which is medicine from India. It's been anciently used. It's a really effective way to aid in dental health, and one of the things that also, aside from kind of keeping the flora balanced and removing bad bugs, is it does a really good job of balancing pH in the mouth. And the thing about these bugs is pH is like the acidity or the alkalinity of the mouth, and the bugs that are most problematic tend to be the ones that like a higher pH. So the more acidic the mouth, the more problematic bugs you're going to have in there. There's actually a great way to test for it. It's called a pH strip. So you test a pool for pH, you can test your tongue for pH, your mouth for pH, and you want to try to get your pH up to as close as 7 as possible. And these pH strips are cheap. You can get them for $5 on Amazon for a roll that will last you years. So you can check the pH of your mouth and see where it is in the acidity levels. Is there a question over here?
Yeah, I've always heard, or what I've read about oil pulling, it's always been like 20 minutes. You said 3 to 7, so I was just wondering why the discrepancy.
Because I've never met a patient who's willing to do it for 20 minutes.
Yeah. Is there a benefit to doing it? Half an hour.
I would suppose that you could have some benefit, more so for doing it for that long. But I think the gain of 5 minutes versus 20 minutes is somewhat marginal. That's just an opinion of mine. I don't know if there's strong research.
I just noticed there was a difference in the oil, because when I first started doing it, I couldn't do it that long. It was just like bleh. So I would spit it out, but when I got to where I could do it for 20 minutes, the oil was very foamy.
Yeah.
So
You can get it pretty foamy in 5 minutes if you're really working it.
Oh, okay.
Yeah, you're just kind of breaking the bonds down of the oil.
Gotcha.
There, it's not necessarily there's that much more bacteria in it or something.
Oh, okay.
Yeah.
Organic almond or olive oil are okay?
Yeah, you could do olive oil. Just got a pretty strong taste, so you could use almond or olive oil. Yeah.
How about an MCT oil?
Yeah, you could use MCT. That's similar to coconut. Yeah.
And one last question in regards to, if not using Listerine or oil pulling, what about a water pick?
Yeah, water picks are fine. They don't work as well as floss.
Oh, really?
Yeah, floss is going to work better for sure. It's just not going to have the debriding effect that surface to surface contact has with floss. They're not a bad tool, but they're not a replacement.
Well, I heard that floss has some kind of chemical that's not very good.
Yeah, I mean, it's definitely challenging to kind of get, in the natural world, a perfect compound. But, they usually have some sort of polymers or plastic material, which is not ideal. But again, you're not ingesting it, so to me, it's not something that I would avoid because of that. The implications to dental health of not flossing are much higher from the microbial standpoint, is my feeling. Yeah.
How about food grade hydrogen peroxide?
Pretty caustic. It's kind of like Listerine, but maybe, yeah, I put it in the same category.
What was the question?
Hydrogen peroxide. It's pretty. Hydrogen peroxide is very radical in terms of it's a free radical, so it likes to smash into things and react. It's good for killing bugs, but it is also not gentle on tissue either. So doing that every day, I don't think I would advocate to patients. Yeah.
When it's food grade, that's a higher percentage than the one that you can buy that's only like 3%.
Yep, it's still hydrogen peroxide, so you're still swishing a really highly reactive compound in your mouth.
That oxygen, but the oxygen is good for your, I use it all the time. It just
Well,
seems to,
yeah.
I
Yeah.
only use a little bit.
Yeah, I understand. I
But,
mean, yeah, I just think that, you know, like again, what I was advocating and the kind of topic came up is if you're to choose a tool, I would choose brushing, flossing, and oil pulling if you're asking for my perspective. But I'm not dismissing or saying that's invalid. I just personally am not very comfortable with hydrogen peroxide as an internal medicine. By the fact that you're not swallowing it, that makes it a lot less caustic on the body. So it's probably much, much kinder to the body that way.
Doesn't it kill all the good microbes too?
Yeah, I would argue that's the case. It's not distinguishing.
It's treated the same way.
Yeah, it's not distinguishing, exactly.
Right.
That's my bigger issue with it.
Yeah.
It's also really dry.
So when would you do the oil pulling? Is that after you brush and floss?
Yeah, I personally like doing it that way. After you've kind of disrupted everything and moved some things.
Okay. And you recommend that daily?
Yeah, if you can manage a habit with it. Yeah.
Can you talk about the mechanics of at the chemical level or the atomic level, how that works?
Yeah, so with oil pulling, so bacteria, all cells really have what's called a lipid bilayer as their protective structure. So to dislodge and break apart bacteria, meeting it with an emulsifying agent like another lipid, which, you know, MCT or coconut oil is a fat, helps break open those membranes, which lyses them and then, you know, essentially allows them to kind of get disrupted and move out of the mouth. Yeah.
Do you mind repeating the question when someone?
Oh yeah, sure, yeah. I'll
Especially if
repeat
it's
the
from a female.
Sure, yeah, I'll repeat the
Can't do
questions.
that well.
Thanks for letting me know. Yeah.
So what does the consumption of lime, lemon, high acidic food like that, what does that do to the pH?
Yeah. High acidic foods, what does it do to the mouth pH? I think you have to be careful with, you know, acidic foods overdoing them. Interestingly, limes and lemons, although they're acidic in the mouth, in the body they're very alkaline. So systemically, limes and lemons can be really nice to lower or to increase pH, to reduce acidity. But in the mouth, if you're overdoing it, it can get a little problematic, especially if the mouth has sores in it and has broken membranes. It can get pretty painful. So you got to be careful with those. And it can even etch teeth if you do too much of it. You know, it can break down enamel. So yeah, I wouldn't do tons of those and suck on lemons and stuff. Yeah. Randall?
If you're doing a blood type diet and coconut oil is on the avoid list, would this be an exception or would you prefer?
Yeah, if you're doing blood type diet, coconut oil is avoid. I think it's an exception. You're not ingesting it. It's not interfacing with your immune system a lot.
Have you heard of something that requires a prescription called magic mouthwash?
I don't know about magic mouthwash. Yeah, you'll have to tell me more about it.
All right.
Okay. Yes, Lita.
As far as, like swish after you brush and floss and do that, do you have a feeling on using, like salt water? You know, Himalayan sea salt and warm water just to rinse?
Using salt after brushing and doing all of your oral hygiene. You know, I guess salt has some antimicrobial properties to it. It also can be a little abrasive and drying because it's a hypertonic solution, so it sucks moisture from the tissue around it. I think as a daily practice, I probably wouldn't recommend it, but when people are sick and, you know, it's got that property, sometimes I'll advocate a little of it, but I don't see it as necessarily health advantageous. Yeah. Jamie?
I was just wondering, would it be of any benefit to add like an essential oil to the oil pulling?
Can you add essential oil to oil pulling? Certainly you could. You could use like a little bit of peppermint. You could use a little bit of myrrh, which is antimicrobial. There's several antimicrobial, botanicals. I really like bloodroot. Golden seal doesn't taste great, so I don't think I'd probably add that. But yeah, you could definitely add those. And in fact, a good way to make a just homemade toothpaste, you can use a little bit of coconut oil, and you can use some baking powder or baking soda, a little bit of salt, and you can add a few drops of essential oil to it, like peppermint. And that's a really good homemade. It makes the mouth pH a little higher, so it's a little alkaline. And again, these foaming toothpaste, they're actually got all sorts of compounds that people are reactive to. It's just kind of that foamy feel that we've all been kind of triggered to think we need in order to brush our teeth. We don't need those things.
Some of these you wouldn't do if you're doing a lot of homeopathy though, right?
Yeah, the essential oils, yeah, you want to be careful with them. Yeah.
Would baking soda be hard on the enamel or not?
I mean, if you're leaving it there, but if you're rinsing it off, I think it's, you could use a small
It can be abrasive. Okay.
Yeah, it can be, but I think using a little bit is okay, personally.
I was just at the dentist, and he said that commercial toothpaste causes a lot of problems in mouths today.
Yeah, it does.
And
yeah.
he recommended just strictly baking soda. Just use that for your toothpaste all the time, alone.
Yeah, you could use it alone, that's
Yeah.
possible. Jamie?
Sorry, the other part of my question was, do you know about the Tooth and Gums tonic, the dental herb company one, that's like mostly essential oils?
Yeah.
Is that any exception to the mouthwash situation you're talking about with the wipeout, or is it?
Well, some essential oils can be pretty heavily antimicrobial and pretty widespread. I would say it's better than something like Listerine, but I don't know if I would have people do that every single day. It's just some of the herbs in there are pretty potent because they're essential oils. Yeah. Yes.
So when you're saying about commercial toothpaste, is Sensodyne one that you would not recommend?
I mean, it's hard to say which toothpaste I'll recommend, but the principle of what they put in toothpaste, that's like the sodium lauryl sulfate, the endocrine disrupting compounds. There's just a lot of compounds that inevitably get ingested or absorbed that systemically I don't see as friendly compounds to the body.
Okay.
Yeah, and a lot of people have sensitivities to some of them. Yes.
There's a great one called HomeoFresh that I think you can find on Amazon, and it's also compatible with taking homeopathic.
Yeah, a HomeoFresh, name of the toothpaste. I use one with neem. I got over here that I like. It's Ayurvedic. It's a really nice compound. Yeah, so there's a lot out there, and you can make your own, like I said. Yeah, in the back.
So my brother-in-law had to take radiation, and he said that he can't get rid of some thrush in the back of his throat, that it comes back, and then it'll go away for a while, and then it comes back.
Sure.
And I was wondering what advice you would say to, and what is thrush in the back of your
Yeah, thrush is an overgrowth of candida. So that's actually a yeast. It can be a problematic yeast if you get too much of it. And it actually brings up a good point of one thing I wanted to mention that's a big miss that a lot of dentists don't pick up and a lot of people aren't aware of, which is people who are mouth breathers. And being a mouth breather is as in like when you're sleeping. If you're breathing through your mouth, then you're drying out your tongue and your gums. And it turns out that that doesn't really help the balance of the bacteria in your mouth. And it can tend to really predispose to a lot of the pathological bacteria and can really predispose to those bacteria embedding into the gums and into the enamel much more easily. So there's a lot of defensive, immune protective compounds in our saliva. And so part of what keeps our mouth, our teeth, our gums protected is the defensive protective molecules in our saliva. If you're a mouth breather, or if you've had radiation and you can't produce mucus in those tissues, then a lot of that tissue dries out and is much more susceptible to infection. There's some other ways to work on it. We'll get into systemic ways to help oral bugs, but that's a big issue, the mouth breathing. And so how does that happen? Well, people got congested sinuses. And a lot of people have congested sinuses. And so they breathe out of their mouth. And what causes that is a lot of people have a messed up gut, and they have a dysregulated immune system, and the body's trying to kick off inflammatory compounds that are coming through the intestines, and it causes mucous membranes like the sinuses and nasal passages to swell or accumulate debris and block off the nose. So you could take steroids and drugs and stuff, but that's not treating the problem or the cause. It's just kind of poorly treating the symptoms, and side effects come with that. So my guidance with those folks that have chronic sinus issues is to really get to the bottom of, you know, how their immune system's dysregulated and why it's pushing inflammation out those passages.
How does tonsils play into this?
How does tonsils play into it? Same story. The tonsils are a center of immune activity. They're lymph nodes in the back of the throat. And so when we have inflamed tonsils, we have a dysregulated, overactivated immune system. And very particularly, if you notice the tonsils, they're the first gateway of the food coming into our body. So it's, you know, to me, a really strong indicator that there can be an issue with food. But furthermore, when these things get chronically inflamed, they'll actually get infected. They'll have so much, the immune system will be so compromised that microbes can invade the tonsils and actually, in and of themselves, cause problems. Sometimes we've got to treat those swollen tonsils with antimicrobials too. But it's also about fixing the gut, balancing the flora, that kind of situation.
So tonsillectomy, you're removing lymph nodes from the system?
Yeah, with tonsillectomy is removing lymph nodes from your body, so removing one of the key lines of defense orally for your body. Yeah, it's not what I prefer, and I've helped a lot of people avoid that procedure, kids, but you really have to be committed to the path of reversing what's been created once it builds a lot of steam. Yeah. You in the back?
You said that inflamed sinuses can be an issue with the whole GI tract.
Yes.
And that it needs to be balanced and get to the bottom of that problem. How do you do that?
Yeah, well, we're going to touch on that in a second. Maybe we can just jump a little bit into it now. So, you know, obviously if we're talking about the sinuses or we're talking about the throat, we're talking about mucous membranes. So, you know, the mouth is a mucous membrane, right? So it's all the same conversation, basically. And what the argument we're making is that the snapshot of what you see in the mouth microbially is in part a mirror to what you're going to see more systemically in the rest of the digestive tract. So if you see really problematic organisms in the mouth, you're probably going to have really problematic organisms in the rest of your gut. And the real question becomes, well, what's informing that? Why are the bugs that cause inflammation, tear the membranes open, release toxins, break down tissues, why are they flourishing in someone's body? And I think, you know, there's a few things we've already talked about. Mouth breathing is one. Poor dental hygiene for the mouth. But if we're looking real systemically, we're kind of talking about, in large part, nutrition. Because those bugs that live in our gut, their viability is basically predicated on what they're getting to sample of what we're taking in. So, you know, the other big arm of that is probably stress response and how that impacts the quality of how we break down and assimilate food. So it's pretty simplistic to just say you need to eat right to have healthy gut and have a healthy microbiome. It's how you eat your food, and it's how stressed your body is for its ability to break down the food that is equally important to the health of the microbiome and the intestinal system. I just want to mention that. But if we really focus in on the dietary side, what we tend to see, and this is actually a great study that a really cool dentist did in the early 20th century called Weston Price. He went all around the world and studied like these really isolated civilizations and cultures, and he looked at their dental health as being a dentist, and he looked at what they ate. And he found out that the ones that ate a highly plant-based, high-fiber, low-starch, low-processed food diet had really healthy teeth. In none of the cultures he found did they have like any oral hygiene practices. They didn't brush their teeth or anything, but the cultures that had this, you know, again, high-fiber, high-plant material, low-starch, low-sugar, low-processed food had really healthy teeth. And the ones that had high-processed food, high-sugar, high-starch, low-fiber had tons of decay going on in their mouth. So, you know, and I would pretty much say that, well, that's an example of dysbiosis in the mouth like we've been talking about. But what's really going on there is it's not just happening in the mouth, right? It's happening in the gut too. And when those bad bugs, so to speak, have a way higher percentage of the real estate in the gut, they start really wreaking havoc in the form of metabolizing those starches into a bunch of toxins and kind of creating a real inflammatory environment via the immune system and the tissues around where those microbes are. To the point where if it goes on long enough, you break down those tissues in the gut and you start leaking toxins and inflammatory compounds and even microbes right into the bloodstream. And I think those are places where you start to deal with systemic issues like sinus congestion or headaches or arthritis or, you know, any number of, you know, basically infinite number of chronic patterns of health dysfunction.
Is it possible to reduce that damage in your gut?
Yeah, you can completely reverse it, actually, 100%. It happens a lot quicker in younger people who have had it going on for less time and who are more vital than older folks who have had it going on for longer and are less vital, but absolutely you can reverse it, and you can do it pretty, you know, assuredly, you know, doing core root cause, you know, focused medicine, which is, you know, what I do with people. And it's definitely a participation required process, right? There aren't any pills for it. There are medicines that can bridge and support the process. If you want to get rid of the bad bugs, sometimes you need to kill some of them. So there's antimicrobial herbs we can use. And there's herbs to help the lining of the intestines repair faster. But generally, it's a nutrition, it's a stress, it's a lifestyle, you know, conversation that we're looking at to do that. So yes, and it has an enormous impact on the gut lining, has an enormous impact on the health of the mouth.
What about mental health?
Oh, well, for sure, yeah. I mean, if you go to, mental health was the question. If you go onto our website and look at our videos, I would say probably like a quarter of them to a third of them are about how gut health affects various systems in our body. So you can watch huge lectures dedicated to those types of things. Gut-brain connection is one that I did a couple years ago. Yeah. Randall?
Can you reverse tooth decay?
Let me get to that question in a second. I want to talk about decay. I want to get into that as like a topic. I'll come to it. Yeah.
As far as gums receding or pulling away, can you reverse that?
Can you reverse receding gums? Again, I want to talk about that in the context of decay, but I think both of those questions are maybe for me. I don't have enough experience, given that I'm not a specialist in dental health, to like really speak confidently to that. But I think in theory it's possible, more so with the gums than with the teeth. And I think there's a difference between inflammation of the gums and recession, losing the gums. I think both are very difficult to regain once they've been lost, because you've actually lost tissue. And those tissues don't tend to be like the liver, which grows back. Yeah. So any questions about where we've arrived at so far? We're talking about systemic contribution to oral health. Okay. So what can go wrong in the mouth? Like, how does this process play out? So you're not doing dental hygiene, or you're eating a poor diet, or your mouth breathing, or you're stressed out all the time, and all these things are chronic, and it leads to probably the first thing we start to see is those biofilms of bacteria build up, and we start to see inflammation of the gums. And what we notice, primarily gums bleed easily. If we try to brush them or floss them, they're bleeding a lot. You can have more redness and swelling, discoloration. And so, we get the beginnings of what we call periodontal disease, which is basically buildup of bacteria to the point where it's irritating and disrupting and kicking toxins off into those tissues. If that happens significantly enough, we can actually build outright, full-blown infections in the mouth, and that can look pretty nasty and be very painful. This can also progress in the rest of the mouth, mucous membranes. We can get sores in the mouth, canker sores, very common thing. That's something you'll observe often, people with recurrent canker sores. It's an issue with the bugs and the acidity in the mouth. I mean, that's what's going on there. And what contributes to that, basically. Food, stress, these kind of things. You can also get lesions developing, so you can get outright infections. Like I said, there's terms called like leukoplakia. Someone mentioned thrush. That's an infection on the tongue. Leukoplakia is a candida infection on the sides of the mouth, on the roof of the mouth. And so again, these can develop when these other things are in place, or when the immune system's compromised. That's a big topic we're going to keep coming back to, is immune compromise and how that affects dental health and systemic health. It turns out that where does the immune system get most of its vigor and intelligence? The gut and the association with the bugs in the gut. So a healthy immune system is a healthy gut. And so we're talking about a healthy mouth and healthy bugs in the mouth. We're also in the same breath talking about a healthy immune system, because if the bugs are healthy, then the immune system has higher intelligence and is not as distracted and revved up dealing with the infections in the gut or the infections in other places in the tube, so to speak. But stress plays a big role in the immune system too, so we can't ever forget that as a partner there. So if we're talking beyond the gums into the actual teeth now, what can happen there? Well, if there's, again, enough biofilm building up on the outside, on the enamel, those bugs, even though the enamel's pretty strong, those bugs being there persistently can start to find little cracks in the enamel and dive in there and start to multiply and actually start to metabolize and digest the edges of our teeth. And so that, if left unchecked, the bugs start to eat through the enamel, and there's not too much problem when they eat through the enamel. I mean, you're vulnerable, but you're not going to have sensitivities. Remember, there's no nerves on the enamel, so you're not going to run into too much pain or symptoms there. And what you'll know before it starts eating the enamel is you'll have plaque on your teeth. You'll have these films, like literally films. I mean, everyone knows that if they haven't brushed their teeth and wake up and it's fuzzy, right? That's just bacteria building up on your teeth. And so if you don't brush it off, again, it's just going to keep building, and eventually, especially if you have vulnerable enamel genetically, it starts to pierce into there and start to digest it.
How does sugar play into this?
Well, as I said, sugar and starch feeds the bugs that are flourishing, and they're going to grow more rapidly and be more aggressive when there's sugar in the mouth. It's also why people who are eating all the time tend to have way bigger issues with their dental health, because you're constantly feeding the bugs in your mouth. So you know, one of a million reasons I don't tell people to eat meals and snack all day long. It's just, to me, there's a lot of reasons from a health perspective it's not healthy, and this is one of them.
Are those bugs the ones causing the teeth to yellow and?
Yeah, there's other things that do that. There's things that stain them. So what you're really looking at is, you know, and there's some genetics to that too. You know, people have probably heard of calculus or calcium buildup on the teeth. That tends to be more a predisposition as well. So you have to remember that there's plenty of genetic components. But yeah, that yellowing, tea can do that, coffee can do that, cigarettes can do that. It's compounds that have a staining ability is basically what we're looking at there. Yes?
Do antibiotics do that? I mean, because I've had a dentist tell me I took
Yeah,
penicillin for 25 years.
it's possible. Yeah, that can be an adverse reaction of teeth alteration to certain antibiotics. Yeah, Judy.
Do you have a good, safer, like whitening solution? I know oil pulling will probably help, but I drink a lot of tea, and I think my family hereditarily has more yellowish color, and it's always been like a problem that I've had time to solve, so. Any thoughts on that?
Yeah, things that bleach teeth. Well, the question is there anything that bleaches teeth that's natural?
Yeah.
You know, I'm not aware of it. Of course, teeth are very you know, kind of resilient and dense tissues. So to change the color of them, you're going to need a pretty strong compound. And in the natural world, it's, you know, tough to know of anything that has had appreciable, you know, observations like that.
Do you think that bleaching is safe? Because that sounds just too toxic to me. It's always freaking me out.
Is bleaching safe?
Like they have the crest strips, and they have like the trays that you can do at the dentist.
Yeah, so, I mean, you know, bleaching your teeth, like you're using compounds that do have a pretty, you know, oxidizing, meaning free radical effect on the teeth and gums. So to some degree, it's not, you know, doing no harm, but the extent of, you know, systemic harm you're doing there, I don't think is large. So it's just, you know, kind of a question of, you know, where's your balance point around and how important is it to you aesthetically to have your teeth be a little lighter, and, you know, are you a sensitive individual where you might have more of a serious systemic impact? You know, some people, we could argue, could, but I think it's pretty unlikely. And the back.
I know some dentists are using that laser light to lighten, so I was just
Yeah.
curious if that's.
That's interesting. To me, that would be safe, or pretty safe. Like,
Okay.
I mean, if you're
It's
using.
not killing off the bugs, or the good
Yeah.
bacteria.
Yeah, but I think really what you're doing with that is you're probably knocking off stain, you know, so. And so to a degree, if you can knock off stain, that's different than changing the fundamental color of the teeth.
What did she say she was?
She was actually laser lights that change the stain.
Yeah, I got one of those little LED things, but I didn't know if it was gonna work, so I haven't tried.
Okay. Yeah, LED is safe on the teeth. It's not gonna hurt.
Wouldn't that be knocking off the enamel at the same time, though? I mean, if the stain's in the enamel,
Well, the stain's on the surface of the enamel.
but it is the enamel that is staining.
Yeah, correct. It's staining it, but it's like, you know, like if it's like you stain a cedar fence and you power wash it. I mean, okay, arguably, like you're gonna strip tiny amounts of the cedar off of there, but you'd have to power wash it like hundreds of times, you know, to where you really degrade that fence appreciably. Yeah.
What would cause a tooth to darken?
What would cause a tooth to darken? Usually when the tooth dies is a reason they darken.
Would it be more at the base?
Well, so let me get into what we're talking about here. So, you know, okay, so one thing about the tooth, so say we're talking about these cavities, we're talking about decay. So if it gets through the enamel, you know, we're still okay, but if you're vulnerable, you gotta watch it. And when someone was asking, can you regenerate teeth? I feel like it is possible for people's enamel to kind of, you know, be a little bit invaded, but go the rest of their life and not have an issue. I don't think you can grow that enamel back, but maybe you could just, you know, keep a nice strong surface just a little lower down. But once you get decay into the dentin, Then you're looking at, pain for sure. And you're looking at that infection being awfully close to getting into the nerve root here. And we don't want that. So my personal opinion, and when patients ask me about this, is when they have appreciable decay into the dentin, I think that it needs to be addressed in a dental setting. Because there's no way that you can pull all that infection out of there and not have the microbes coming in and reinfecting it every day without getting a barrier put on it. And so, I just don't think there's any herbs or compounds that can really do that, because there's always bugs in the mouth. And they're always going to be growing. And that tissue, now that you've lost the protective layer of the enamel, it's way more vulnerable. Okay. So usually if it's just getting into the dentin a little ways, a dentist can come in and they can, hollow out that all the decayed tissue and take a little margin, so you're definitely not having any of that invasive bacteria stay in the tooth. And then they can put a material on top, match the old bite surface, and basically that tissue inside is now protected and it's clean, it's not infected. Okay, so if it's a small enough surface, that's what's called a filling. And so there's a few different types of fillings we can do, and we can chat about that for a sec, because I think probably folks want to know about that. The old school kind that always used to be done were amalgam fillings, which is a combination generally for the main ingredients of silver and mercury. We've learned in modern days that mercury is not that great systemically in the body, but the dental, the line of reasoning officially is, oh, well, the mercury stays in the filling, so it can't cause any systemic issues. Well, we know that pretty clearly to be untrue, and I'm not going to go into too much depth about why we know that to be untrue, but suffice to say that I'm not a fan of amalgam fillings, because you're putting mercury in the mouth, and that mercury off-gasses, meaning it releases out of the tooth over time. And that release, of course, can release right into the tissue, or it can release into the oral cavity and be breathed in to the lungs, which gets systemically absorbed. And mercury is not a good thing to accumulate in the body. That's why I don't recommend my patients are eating tuna fish all the time, for a different reason, because mercury tends to accumulate up the food chain, and if you're eating high-level food chain foods that have a lot of mercury in them, you're ingesting mercury, and that's not a good thing. Mercury can have a lot of systemic health effects. A lot of them are neurological, and so chronic mercury burden is a thing, and I definitely, the best case scenario is don't put it in your mouth to begin with. And we'll get into how to deal with mercury in a minute. I can talk about that. But that's one of the types of fillings you can do. The other type that's probably the most common now, the next type is called composite. Composite is what it sounds like. A composite is a composite of a lot of different compounds. They are plastics, basically, primarily plastics. Better than mercury in your mouth, but still plastics in your mouth. And if you look at the ingredients of these plastics, they're not the friendliest, right? I mean, there's endocrine disrupting compounds, hormone disrupting compounds, there's petroleum products in them. These are things that if we put them in the body and look at what they do to tissue, in organ systems and hormone systems, we're not thrilled about it. So my preference is to not use those if possible. They're the most cost effective. The ones that are the most expensive and don't last super long are ceramic. But they're, environmentally speaking, health speaking, probably the healthiest. So they're not, ceramic is, again, basically mineral compound, porcelain-based. These have very little reactivity to the body. They don't have a big electrical charge. There's no metals in them. Electrical charge can be a problem because, you know, all of our cells are electrically charged. So if you put a new electrical charge in, how is that influencing tissue? So ceramic doesn't have any of that generally. Problem is it doesn't last as long as it's much more expensive. But if you're putting... Yeah.
How long does it last?
It depends, right, on the individual. But, I mean, it'll last years for sure, but you could be looking at down the road 10 years or 15 years or 20 years, maybe you need to replace them, or even less time. Yeah, yeah, it could be less.
Are you finding out too the differences between composites versus ceramic? Ceramic doesn't stick as well as composite.
Yeah, right.
So how much more roughing and how deeper do you have to go?
Yeah, so it's a great point. Yeah, thanks for bringing that up. You do have to go deeper and you have to rough the tooth down more. So you have to take more of the intrinsic structure out of the tooth, which you could argue could be problematic, in order to interface that and glue that to the existing tooth.
So you're getting close to the, or on the edge of going to full cap.
Yeah, which is called a crown.
Or crown.
Yeah, full cap. And that's, you know, again, obviously instead of just a corner of it, the full cap is when, you know, you have enough decay that we need to do the whole surface, grind it down, and, you know, put a whole cap over it of one of these artificial materials. So, and of course the adhesives, what you use in the adhesives, that matters too. So as we get into all this like dental terminology, obviously, me as the naturopath, I'm not doing any of this. So really like, and I want to talk about this tonight because it's a cool topic and I want to help educate, but what you really want to be looking for is a biological dentist. They're going to be more savvy on, very savvy on all of this stuff, including mercury removal and, you know, so if you really have this type of value system around your health and what you put in your mouth, really caring about it, those are the type of dentists who have further education and knowledge and offering of those services.
Where do you see that? I mean, they don't advertise on the biology dentist.
Well, they do, just not in this area a lot.
Is there any insurance that covers that?
Any insurance that covers biological dentists? Yeah, I think a lot of them take insurance. But in terms of some of the individual procedures they're doing, may not be covered by insurance. We can get into some of those procedures, but yeah.
We have a biodentist.
Yeah, great.
And it is covered by my insurance company.
Exactly. Yeah, cool.
Is it in this area?
Spokane.
Good. What's the name of your insurance?
Well, let's wait. Let's just do the whole group here. Okay, so you can all hang out after. So I'm not going to go into names of people. I mean, you can kind of look this up or come up to me after if you want to like know about the local ones and the regional ones I refer to. But just to let you know that, you know, there are dentists out here that are knowledgeable in this languaging and don't just take the standard bearing of what the ADA or the American Dental Association says that, you know, how to kind of, that all these compounds don't have systemic, you know, potential systemic issues in the body. And again, it's not everybody, right? This is like, depends on your susceptibility, depends on your overall health and vitality, depends on how healthy your immune system is, right? So if you have this kind of stuff in your mouth, you know, it's not the end of the world, especially if you're relatively healthy. If you're not healthy and you're having chronic health issues, it may need to be something we look more at, right? I think that appreciation is crucial here, that you shouldn't walk out of this meeting saying, I need to take all the dental work that's ever been done in my mouth and replace it all, and that's my #1 health priority. I would say there's so many other things we can look at that are going to contribute to your overall vitality and the robustness of your immune system. And that often is more financially accessible to work on that. And those are the things we should focus on, if not equally, certainly, you know, most prominently.
What about dementia and all that? You said it was neurological, that the mercury.
Neurological with mercury, yeah, it can contribute to dementia.
How come they don't use gold anymore?
Question of using gold. They do use gold still. It's a metal though, right? So it's you know, it has charge to it.
Right, but how would it compare to the other fillings that you talked about? Is it the least dangerous, but the most long-term?
Yeah, you know, that's a good question. I think, you know, with gold, is it the most long-term? They're expensive. They're really expensive, so they're definitely more expensive than the ceramics. But they, you know, and they have a charge to them. And gold, as it accumulates in the body, should it be shedding in any way, is not something you per se want to accumulate in the body.
Right. Does it hang in the body like mercury does?
It's not nearly as toxic as mercury.
Okay.
Yeah.
And when you say charge, you mean it causes free radicals in the body, or?
An electrical charge.
An electrical charge
Yeah.
in the body, and what is the repercussions?
It's going to be more of a local repercussion, arguably. But if you're of the belief system that, you know, things in different places in your body radiate out into the entire body in terms of how cells communicate, then you might have a concern about that. And again, I'm not going to go into like a personal diatribe or anything. I just, you know, for some people that matters. Yeah. Yeah, I mean, I'm getting there. So we're getting into the tooth, we're carving in further, right? Like decay is going further in. So what if the decay goes all the way in and we pop all the way through the dentin and it's chewing in those bacteria, and then they drop into the root? And usually you're going to be in a lot of pain if it drops into the root, because there's a lot of nerve endings in there. Well, then what happens is that bacteria pretty quickly kills the nerves in here, this big nerve coming up that's supplying, and there's blood flow and all that. That bacteria can just start, you know, chomping right on those nerves, and you basically end up killing the tooth, right? So the bacteria have, you know, cannibalized your tooth, and now it's dead. So basically the nerve supply that is critical to having the blood supply to the tooth is now compromised, and now the tooth is this dead thing in your body. And what do you do about that? So there's a few things out there in the dental world that are proposed. One of the things is, well, you can just pull the tooth out and just leave it out. That's called an extraction. And you've taken all the dead tissue out of your mouth, but if you really want to take all the dead tissue out, you have to go down to this base of this little periodontal ligament. You have to cut that guy out, and you have to scrape out a little bit of the tissue in the bone where that infection can actually get down to. That's a really important question to ask your dentist or your endodontist if they're doing a root canal, or your oral surgeon if they're doing implants, is, are you, I guess general dentists can do a lot of this stuff too, but if you're using a specialist, like, are you, you know, kind of carving in 1 millimeter into the bone, and are you pulling the periodontal ligament, because infection can hang out there. Anyways, but you extract the tooth, and then you can put like a little flipper tooth in there, or you can actually put a partial denture in there, which means replace the tooth with a wiring system that sticks a tooth there. And that's probably the cheapest way to go. I mean, that's probably how you can most inexpensively deal with a dead tooth. And you could also leave the socket open, I suppose. Some hockey players like to do that in the NHL. But it's not generally culturally or societally pretty acceptable to do that. Yeah.
So how do you know whether they've done this if you haven't asked the question? If the tooth is pulled and it heals up like it's supposed to, you know, where there's no sign of the tooth or any other factor, how do you know whether that was taken care of or not? Is that how you know?
You have to ask them. You have to ask the dentist.
Will the gum be healthy whether you ask them or not if it's not infected like that?
What's that?
Will the gum be healthy? I've had teeth pulled before.
Yeah.
The gum's healthy.
Yeah. The gum could be healthy and you could still have infection in the root.
Where the root was.
Yeah, where the root was.
So
like where
then what?
Well, so then you have a situation where you have an insidious process of infection dripping into your bloodstream, you know, for the rest of your life.
How come the body cannot fight this off? If
It can, so the body can fight this off, right?
Okay.
All the caveat to this whole conversation is
Okay.
someone with a healthy immune system, we're going to really talk a lot about root canals in a second, can really not end up having any issues from the fact that they have a root canal. If systemically they're healthy, which is why you should come see someone like me as a naturopath if there are systemic issues too, right? Because we can work on that together. And we don't necessarily have to deal directly with the dental issue to bring about more robust health and resolve issues. Yeah.
You're not really advocating for a root canal, are you?
No, I'm going to get to talking about root canals. I just said we're going to talk about it in a second. So we good on, extraction, what that means? Okay.
If you have an infection, like the gentleman said, his gums are healthy, but you might still have an infection down there.
Down in the bone?
Yeah.
And the periodontal
Are
ligament?
there any kind of symptoms, anything that would clue you in to think that maybe that's going on?
The question is any types of symptoms that might be going on. Well, certainly, you could have some sort of jaw pain and, inflamed lymph nodes. I mean, that would be a very local symptom if that was a really progressed infection. But if it's more systemic, I mean, you can look at the systemic conditions associated with chronic dental infections. So you could look at heart disease, diabetes, arthritis, fatigue, generalized fatigue. Yeah, a lot of things can be associated with it, neurological issues. So it's one of those detective things that, as clinicians, clinicians, we have to have on our radar is, and I like to know about people's dental health pretty thoroughly when they come in as a patient, because that might be something we need to consider.
Would the white count help you find those infections?
White count could help, white blood cell count can help find infections in the body. A chronically low white blood count, or with really overt infections, the white count can go really high. Your balance of lymphocytes and neutrophils, how they look, can tell you a little bit. So there's a few tools. Yeah, that's a good question in terms of laboratory testing. Yeah.
And that's called what now when they scrape underneath after they pull the tooth?
Well, it's just, yeah, I mean, that's a cavitation where that little pocket is.
So that's what you ask them if they...
Yeah, are you going to, remove the periodontal ligament and address, any possibility for cavitation by, shaving off a little bit of bone? Yeah. So it's kind of like we talked about, the cavity, in the decay, you don't just go to the edge of the decay, you go a little bit beyond it, right? Because you don't want the risk that there's any leftover infection that you're sealing in. Okay. So root canal. So what is a root canal? So the infection's got into the nerve, into the pulp, and the tooth dies. And instead of pulling the tooth out, we make a hole in the top, and the decay has already made that anyways, and we take all these little tools and we drill down and we clear out. It's like if you have your sewer rotor-rooter, it's like doing that in the teeth. So you're going to clean out all the infection with all these different drill bits, and then you're going to fill it all with a plastic material, and then you're going to cap the tooth. So you leave the rest of the tooth in place. And so this is a very, to me, paradoxical procedure, because it's like, would you ever tell a surgeon, okay, part of your kidney died and you're gonna, or your kidney's dead and it's infected and you're just gonna leave it in the body. No, you'd pull it out of the body if it's infected, right? But with root canals, you're taking out the infection that you can visually see, but you're leaving all this other tissue that has blood supply and nerve supply and is able to be metabolized and lived in by bacteria, and you're just leaving it in the mouth, except now you've taken away the blood supply, you've taken away the nerve supply, and you've taken away all means by which the immune system can protect that tooth. So Yeah, I mean, you probably can tell I'm not a fan of them, because you're leaving a dead tissue in the body that's now incredibly vulnerable, and then you're sealing off the main cavity that goes systemic into the bloodstream. But you're not recognizing or acknowledging or appreciating that coming off those main cavities, there's like 100 other, like it's like a tunnel system, and there's a main tunnel, but then there's like all these little small tunnels running off of them, and then maybe those small tunnels have little mouses that have their own tunnels coming off of them, and those are called tubules, and bacteria can live in all that, and they can grow and flourish and just kind of keep reproducing. And then as they reproduce and they don't have space to go, they drop down and they drop into systemic circulation. Or they go outward and they go into the gums and they go into the bone, but they also go into the bloodstream through the base, especially if the periodontal ligament is left in there, which a lot of times it is. And that periodontal ligament is also a way for a food source to come up into the dead tooth and feed those bacteria.
Immune system that will take care of that?
Well, for a lot of people with a really robust immune system, yeah, as that bacteria drops into circulation or even into these adjacent tissues, it walls it off. It says stop here. Or if it gets systemic, it just gets eaten up immediately. People with compromised immunity, yeah, there could be a different situation. But even then, those people with a healthy immune system, some of those bacteria are going to go places in the bloodstream that you don't really want them to be, like the arteries, the joints, and this is where that heart disease connection is going to start to come in. Is when we talk about how these microbes get into very protected tissue that shouldn't have microbial invasion, and how that leads to disease.
When the bacteria is multiplying sealed in there, is it eating the bone?
Yeah. Yeah, it can eat the bone. Can the bacteria eat the bone is the question? Absolutely, and you can get necrosis of the jaw. Again, this is in a small percentage of folks who are much more immunocompromised. But yeah, you could actually have that infection eat right through bone. Yeah. So does everyone get the idea of what a root canal is? Yeah, question.
So it's a pretty common recommendation. What, if you got recommended that, you wouldn't be in favor of it, what's the alternative?
Yeah, so there's a couple more options I'm going to go to now. A good leading question. So there are two more procedures that we can talk about. One of the procedures is what's called a bridge. So when you do a bridge, you remove that tooth, but instead of having this whole thing that spans your whole mouth, like a partial is what they call it, all the wires and stuff, you grind down the teeth on either side, and you make a bridge across them with a fake tooth, and the root's all gone, this is all gone, but there's a bridge tooth across, and it's called a bridge. So that's a solution, and that's possible. The thing I don't love about it is, okay, now you're whittling down the structures on either side. You're compromising the integrity of those teeth, and are they going to go bad? And then what? You could get into it's kind of like when people have spinal fusions. Well, the next thing that happens is the vertebrae on the top and the bottom of that fusion start to have issues, right? So the same thing can happen in the mouth. And that's why I don't love it, but it's better than a root canal, that's for sure. I would take that over a root canal without a doubt. And so, those are also kind of spendy. Bridges are not cheap, right? Because you're working on 3 teeth now instead of 1. So when someone was asking why do you not, why are root canals recommended so often? Partly because it's not as expensive as a couple of the other options, which are, bridges and root canals, or bridges and implants.
Does the bridge sit on top of the tissue, or does it go down where the root was, or just sits right on top?
Yes, it's on top.
So is there a problem between the base of that and the top of the tissue, things getting in there?
The bridge sits on top. Can it have issues? I'm not really clear about that. suppose you could, but yeah, you'd like have to be, I'm sure there's hygienic recommendations that are made by dentists to deal with it, yeah. Yes?
She had one person.
Oh, gotcha.
Oh, that was my question, was if you can clean it still.
Yeah.
Because that was an option for me, it freaked me out, I didn't think I could clean it properly.
Okay.
So with a bridge, you're assuming there's a tooth on either side. If you don't have a tooth on one side, you can't do that, right?
Not an option, yeah, if there's not teeth on either side, that is very true. But sometimes it can work to your advantage and you've had work done on the teeth on either side and then you don't have to compromise them further.
Or you can go across the mouth to the other row of teeth for a bridge.
Yeah, that would be a pretty monstrous bridge, but it's, I suppose. So that's what a bridge is, and that's the issues that show up with the bridge. And then the final option is doing an implant. So an implant, you extract the tooth, and you hopefully go and clean this little cavitation and ligament out. And then you basically implant with a screw a fake tooth into the bone where that tooth was. It's called an implant, and they're usually made of titanium, which tends to be a little more of a reactive metal, but that's what they're typically made of, and so that's the metal, but they're basically metal with, you know, material on top for the tooth structure. And you know, you're drilling them, you're like literally just screwing them into the bone. It's pretty solid and stable, but you do usually have to be put under to have them done, or you can be put under, depends. So they're not fun procedures, you know, to have, but no dental work is. And they're kind of, you know, now you're putting a foreign body like into living tissue. It's not ideal either, right? Because putting a foreign body in living tissue is like, it's like replacing a joint, right? I mean, we can do it, but we don't love doing it because we're putting something that's not us into our body and like locking it in there. And you can do a metal that's a little less reactive called zirconium. So some biological dentists will use zirconium, which is, you know, probably a better option. Yeah, so that's kind of the final option. And that is, you know, if I had to do one, that's probably what I would choose, to do a zirconium implant. I think it's probably the most expensive option. Yeah, a few $1,000s to do them, so yeah.
My dentist wanted to do root canal, and I said no. So then he wants to do implant. It's going to cost $2,900.
Yeah.
For one implant? For one implant, because first you pull the tooth, then you put bone graft, then you put the post, and then you put a crown.
Yeah,
and
right.
all the steps, which is about 4 steps.
They're different visits.
6 to 8 months. And then, because each stage is a little bit of healing.
Yep.
And then it'll cost, and he said he's cheaper than most.
Yeah.
He's like 25% cheaper. He said some dentists can cost $5,000.
Yeah.
For
Yep.
one tooth.
Yeah, it's one tooth, yeah.
said the same thing, it was over $5,000
Yeah.
for one tooth.
Mine's only gonna be $2,000.
Maybe over 5,000. I think
Yeah.
for 2 teeth, he said 10,000.
I just
$300.
had my tooth pulled.
I think he said.
Yeah, $100 to get it done.
Yeah, go ahead.
So what about the flap?
The flap?
Yeah,
You're talking about a tooth replacement.
Instead of,
Would it be
yeah.
like a little flap, a flipper tooth?
Yeah.
Flipper, I guess it's called.
Yeah, totally. You know, so the flipper tooth, like, could you get one of those? You can. I mean, they're not really structurally sound. They're not really designed for a long-term solution. I mean, because if you look at it, how it's anchored in the mouth and, you know, the leverage the mouth is supposed to have for, chewing, I mean, but it's an option, right? I mean, it's just something you have to deal with constantly.
What about the option of not having anything and you just have the space where the tooth is?
Yeah, a lot of my patients have chosen to do that, just to leave a space in their mouth. That's viable. Yeah.
What's viable? I didn't hear that.
To just, you know, extract the tooth clean out that little area of the root and let it heal over, and just have a gap in your mouth where you don't have a tooth. Of course, there's a possibilities of infection there too that can happen.
Teeth can migrate too sometimes.
Yeah, teeth. Yeah, there's more space.
They don't like a vacuum. They don't like that space.
Yeah.
As a person gets more, my daughter has several root canals, and it just seems like as she keeps getting more and more, and she has excellent oral health.
Right.
She always takes great care of her teeth. I think it's more genetic possibly, but anyway, she gets a root canal, and it just seems like it's like snowballing. Like now she's into her 6th root canal, and then now they're going back to teeth that have root canals and have crowns on them, and there's a problem under that crown now.
Yeah.
So it's like, what is going on? It's like it's just everything's just falling apart.
Yeah. Yeah, and I mean, I can't speak to directly but what that is, but certainly it's unlikely that the dentist is going to look for, no pun intended, the root cause.
Right.
And there's probably, an invitation that could happen to kind of take a bigger, wider lens look at the contributory factors.
So that's kind of what I'm dealing with right now, is I've had root canals that have been redone how many times that the dentist has finally said, I want you to go somewhere else. And I'm just, we need a specialist to take care of these things. And I wish I would have known half the stuff I know now way back when, because I would have never done all this stuff, but I'm to the point where I just want to pull all the stuff out, and they're suggesting either bone grafting and doing the implant, bridging and messing up more teeth.
Yeah, there's
partials.
Yeah, there's no good options, right?
So how do you feel about the whole partial?
Yeah, well, again, I mean, it really depends on it. It's totally an individual question. I'm gonna kind of punt on that because I would really need to take time to look at the individual case and weigh the merits of it. It really is unique presentation, and again, I'm not a dentist, so it's not.
I wasn't sure if the materials they were made out of.
Yeah. Possibly. Again, again, this is something like we're getting into really specific dental questions that is definitely above like my generalized naturopathic physician kind of ability. But I will say just briefly that there are people who just do root canals called endodontists, and if like you got some of this stuff needing to happen, I personally would definitely want to see someone who that's what they do all day for these specialized procedures. There's an oral surgeon that does a lot of implants, and so I guess there's periodontists that work on the tissue of the gums, more specifically, and so you can do, you can see specialists for these issues, and that's probably, if I had that work needing to be done, who I would be going to, even though general dentists do have the training in it. It's just like, like if someone comes into me with major heart disease, I'm going to work with them really extensively in their whole person picture, but I'm also probably going to refer them to a cardiologist to be established at the very least, but also have further level of expertise in care. So, using specialists is good.
Yeah, I just would like to share that I started going to what we called back in the day holistic dentists in the early 80s. It took a long time to find one in Los Angeles, and stayed with that pretty much for decades. I moved out of state for a short time, and I got lazy, very unlike me, and I went to my husband's boss's cousin or something like that, and I didn't really research it. And I had the first teeth problems I've ever had in my life. And, said, okay, I'm going to go talk to my friends who are dentists. And long story short was, it's not that I wouldn't also go to biological or what we call holistic, and you have to just see who it is more than anything. It doesn't matter just that they're biological or holistic, it's are they good and really know their field. And I lost money, I lost time, all of that, because I was with a bad dentist who wasn't holistic. But I learned a lot more in that, and including some of our local, very dear holistic dentists, but not necessarily great.
Yeah, that's a really good statement, and that applies universally to anybody you seek care from, a lawyer, an accountant, contractor. Yeah, you want to go do your research personally and do your interviewing, and I'm trying to provide a service here to give a little different perspective and lens on a topic that I think is very important and underappreciated, and I want to draw the linkage here across to some systemic conditions that can be implicated in kind of a dental issue, an insidious dental issue going on. Yeah, okay.
So the plaque, I've always heard that the plaque that's in your mouth is also the same kind of plaque that you can find in your heart.
Yeah.
Like going down
Yeah, that's a great segue.
Can you talk about that?
Yeah, great segue. So yeah, the thing about heart disease, and this is the kind of loosely the topic I made for this lecture, was giving you the root of heart disease and dental health. Well, it turns out that when we go look at the plaques in heart disease folks, people with coronary artery disease, plaques are like the conglomerated lipids, cholesterols that have occluded the arteries. That, first of all, it's not cholesterol that's the problem in plaques, it's oxidized cholesterol, so it's cholesterol that's been basically beat up with inflammation. And we can go look at those plaques, and the plaques of a lot of these folks have a lot of the bugs that are in the mouth. A lot of the bacteria from the mouth are in these oxidized plaques of heart disease patients. And so, increasingly there's a linkage. There's not a formally causative relationship established yet, but there's a linkage that's been formally established between dental health and heart disease. And so these oxidized plaques that, inflammatory action from these microbes can create are what are, very contributory to occlusion, which means loss of blood flow to the heart, which means, the heart dies, part of it or all of it. Part of it dies, we're still alive. If all of it dies, we're dead. That's a heart attacks. But also plaques can embolize, they can break off and move through the body, and you can create strokes, which is basically those plaques breaking off and lodging in smaller vessels. Yeah.
So while you're on the topic of plaques, it would seem to me, and I don't understand the concept, but if those things are going down through your body into your stomach, it should be dissolved in your stomach if you're healthy.
Correct. So that's making the assumption if it goes down through your stomach and it should be dissolved and broken down. That's making the assumption that you have adequate stomach acid and that your intestinal lining is intact, which many people's aren't. I would even argue the majority aren't. So if you have a leaky gut, you can have microbes move into the bloodstream.
I see.
And so that absolutely can happen. That very much can be a modality through which that happens. But by and large, the intestinal tract and the stomach have a lot of protective mechanisms to break down these bugs and kill most of them. So you're right, when it's just a tissue, it's the bugs in your mouth, it's the bugs on your gums. The enamel has not been pierced, the roots are intact. It's less prominent of an issue that these bugs get into the bloodstream. And then, but what if you had a root canal, or what if you had, kind of like a botched process of an extraction, or something like that? There's a little easier mechanism for microbes to enter directly into the bloodstream. So that is something really to be considerate of with that issue. Yes.
With the oxidized plaques, because it's in the bloodstream, is there a way through focusing through in a blood test, rather than the general sweep that they do in a normal blood test, to focus in on that plaque or that cholesterol, or is there a more detailed test that can be done to break down what microbes you're fighting, especially if you have a sample from your mouth?
So yes, there are tests. It's a great segue. She's asking about testing for microbes. There are DNA tests you can do now with the mouth. You can swab it and send it to specialized labs, and they can break down the microbiome of your mouth and look at how many of the problematic flora that exist in there, how many of those pathogens are in there. They can rate it mild, moderate, severe, and you can then go back and repeat that testing, and after treatment or different interventions dietarily or, you know, hygienically or dental-wise, and assess things. So that's very much something you can do. I don't know if you can go look at plaques and assess the microbes. I mean, theoretically, if you did a stent or a bypass or something, like where you're actually going in and extracting tissue, and maybe you could, but I'm not aware of that.
Well, you already have the avenue for these to flow through your body. The particulates are going to be there, but whether or not they're going to scan for that when they do the blood tests.
Yeah, correct. When you do, usually to look for organisms systemically in the blood, you have to culture stuff out. So I suppose it's possible to culture out those microbes and see if they exist, and then therefore extrapolate that you may have dental-associated bugs more prominently in your bloodstream. I guess that's possible. Not really familiar with anybody doing that type of work.
It seems to me to be a great diagnostic tool for looking at heart disease or possibility of heart disease because of that.
Yeah, it could be. You're right, I agree. Yeah, in the back.
I know that the Northwest Specialty Hospital, or the Imaging Center, they do a new test called a CT calcium
Yeah,
scoring,
yes,
which they do, it's a CT,
yes,
but they'll actually determine the amount of plaque in your arteries.
correct, yeah. But this is different. We're talking about the actual microbes associated with the plaques. And that doesn't necessarily tell you how oxidized that plaque is and the nature of the plaque. It's an estimate of how you can look at the amount of plaquing and calcification. Yeah. Yes.
You mentioned the correlation between the mouth and the heart, and it seems to be pretty strong.
Yes.
But you also earlier mentioned diabetes.
Yeah, so there's a few other systemic diseases where they've drawn links. There's been pretty robust research. Autoimmune diseases. Autoimmune disease is the immune system making mistakes and misidentifying self from non-self. So if you got a lot of inflammation going on, if you got a lot of bugs getting in the bloodstream, masquerading around, the immune system can make mistakes and cause an autoimmune process. Diabetes, arthritis, even cancer, arguably, they say that, you know, some of these bugs cause enough inflammation to alter DNA. And if DNA is altered and it's not repaired correctly, cancer can start as a process. Some neurological diseases have also been associated.
So this is war, basically.
Well, so,
it's kind of like a war.
Yeah.
And, you know, where are you going to start? Well, the front end, your mouth.
Yeah.
And it really is kind of a battle between these bugs in your body.
Yeah, well, it's, you know, I mean, I'd be careful about that because really it's all about susceptibility. As I said, I want to keep coming back to this. It's people with really strong immune systems and a healthy microbiome, which informs the immune system, probably going to have a lot healthier dental health and not have, you know, root infections. They're probably going to have a lot healthier gut health and just a more robust immune system that is really proactive at buffering and, you know, being hostile to foreign microbes thriving in one's ecology. People who see their dentist regularly and go in for cleanings and go in for examinations and have x-rays done, you know, these people are not the people who are having root canals, you know, because they're actually investing preventively. I mean, that's what's so cool about dentistry. People go get their teeth cleaned on a regular basis. Who goes to their doctor preventively on a regular basis? Not much. So for people who are lucky enough to have dental insurance or can afford it, yeah, you know, you're cleaning your teeth and you're getting x-rays and you're assessing the viability of these tissues so that you don't get to a situation where we're talking about these roots and stuff and the chronic long-term consequences that come with that.
Does your office do immune diagnostics where you actually go through and characterize somebody's immune system taking different materials, different cultures, and the same thing you would do for allergies on the back. Do you test for something?
You're asking if we test immunity. I think what maybe I could say is that we'll test the microbiome and some immune markers, we can test through, again, stool testing, but also blood testing. But they're not wildly advanced, insanely expensive tests. Some of them are well-known, even accessible in the mainstream, and some are more specialized. But I wouldn't say it's a prominent, approach that we tout as like, there's so much richness you can learn about someone's health from talking with them for 90 minutes. We usually start there. And if we really see a value to that, we could consider it. Yeah, Jamie.
Maybe you're already getting here, but can we have a little bit of hope sprinkles of like what to do?
Yeah, that's what I want to transition to because I know we're already over time. So, yeah, I'll get to that in just a second. Yes.
I wanted to talk about removing mercury.
Yes, I know, and that's the other big one we got to get to. So I know I said I'll come back to that, but we're going to talk about that for a minute.
The last time I consulted a dentist, he was very experienced, and I really respected him. I think you would too. And he said, if you were having problems with the tooth that had a mercury filling, I would definitely want to take that filling out and put something better in it. But he said, if you're not having a problem with that tooth, I wonder about opening it all up and exposing your system to the mercury.
Yeah, that's
I'd
why
rather
it
not.
needs to be removed appropriately. Yeah.
And he said, I'd rather not, if
Yeah.
you're not having problems, open that can of worms.
Okay.
So then I was really confused.
Okay, I'll talk about mercury in a minute. Yeah. One more question, then we're going to move on. Yeah, go for it.
I wanted to hear more about the correlation between oral health and heart disease, and can it be reversed, or at least a little bit?
Yeah, well, we've just been talking about the correlation,
Yeah.
right, in the microbes and the oxidizing of the plaques in the heart and arteries. So that is the correlation there, that we see these infections going blood-borne into your bloodstream as causing inflammation, impacting the plaquing that therefore leads to occlusions and strokes and heart attacks. So that is the connection, and how you treat it is you address the source of infection and you address the compromise of the immune system. And we've talked a lot about the ways that you address compromised immune system in this talk. Yeah. Mm-hmm. Yeah. So I think a couple of quick things to touch on is, Jamie asked about, are there any things that we can do about this? I mean, obviously your individual dental situation is going to matter, but the infection is, so like you want to go deal with the tooth if we're suspicious that the tooth is causing problems. And we talked about the different ways you can replace a root canal, for example. We can deal with, mouth health. We can be better with hygiene. We can do oil pulling, tongue scraping. These are great tools. We can